Now, it's a little-known condition which, on average, takes 7 years to be diagnosed. Yet it can have life-changing consequences for those that are.
There's been a big rise in cases of postural tachycardia syndrome, or POTS for short, since the COVID pandemic. Yet there are still only a handful of doctors who are specialising in it.
Well, Hannah Ludlow's spoken to one West Yorkshire woman calling for greater awareness and hopefully a cure.
Student nurse Kerry Manzi from Leeds has struggled with even the simplest of tasks since she began developing symptoms of POTS. Daily activities like showering come with the risk of fainting. Kerry says it's an isolating condition.
There have been times where I've fainted or been unconscious, and obviously then it's really apparent that I'm struggling, but the rest of the time it's like, oh, she's fine, she's not, she's standing, she's walking, she's talking, but I could be in so much pain, or I could literally hear my heart rate in my ears, and no one would have a clue.
When a healthy person stands up, to avoid blood dropping down into the limbs and abdomen, blood vessels contract and the heart rate increases slightly to maintain blood supply to the heart and brain. With POTS, this adjustment to standing doesn't work correctly, resulting in an excessive rise in heart rate and altered blood flow to the brain.
Okay, what are your symptoms?
Just the pins and needles in the bottom half of my body, and the heart palpitations as well, and I feel a little bit lightheaded.
Alexandra is being tested for POTS using the lean test at Chapel Allerton Hospital in Leeds. Her heart rate and symptoms are measured every minute for 10 minutes. The results are then studied by a consultant.
The whole field of autonomic dysfunction is not taught well in medical school. To be very honest, prior to COVID, I had no idea about the condition myself. The virus it initiates an inflammatory response in the body, and then it produces what is called as autoantibodies. What needs to be done is to understand more in terms of how the autonomic nervous system gets damaged and whether we can do something about it.
A recent survey of POTS patients found 85% had difficulty accessing healthcare.
Patients are getting referred by their GP to secondary care service, and then when they get their letter back, it's saying, no, I'm sorry, you can't have an appointment, we don't see patients with POTS, or no, you're out of area, so we're not going to see you. And it seems absolutely barbaric to us.
The government told ITV News it's working to revolutionise care for people with POTS by shifting care from hospitals to communities. Next month, the issues surrounding POTS will be debated in Parliament. It's hoped this recognition will be the first step towards real change. Hannah Ludlow, ITV News.